Before I introduce the Minister, I'd like to acknowledge one other person in the room because I think it's important in terms of today's themes, and that is Mr. Peter Wills, somewhere is in the room. And the reason I like to acknowledge Peter is there's probably nobody in the room who has spent more time thinking about medical research, health and medical research strategy in the past 20 years than Peter, and nobody who's done it more successfully in terms of navigating the corridors of power in relation to this. And there's a lot that we can learn from what Peter has done over the years, what Peter has led over the years in terms of what's been achieved in that regard. And we should make sure we seize him during the day and learn from him. So with that, let me please introduce the Honourable Prue Gowd, Minister for Medical Research, to open up today's proceedings.
Well, thank you for that introduction, Andrew. I'd like to start by acknowledging the traditional owners of the land on which we meet, the Gadigal people, and thank Uncle Ray Davison for his welcome to country. I too suffer from hay fever, so on behalf of Aboriginal and non-Aboriginal people in Australia, I think we'd both be very pleased if there was more research into hay fever, just saying. I'd like to acknowledge my friend and colleague Gillian Skinner, the redoubtable Minister for Health, Elizabeth Coff, the Secretary of New South Wales Health, Kerry Chant, the Chief Health Officer, and Mary O'Kane, the Chief Scientist. And to all of you, thank you for being here. Today is an opportunity to consider our collective vision for the future of health and medical research in New South Wales. It's a day to exchange ideas, achievements, and to identify solutions. It's a day to discuss the road ahead. It's almost 5 years since the release of the New South Wales Health and Medical Research Strategic Review, chaired by Peter Wills, and I'm very pleased, Peter, that you're here today. And whilst we're approaching the midpoint of our 10-year plan, we have to acknowledge a lot has changed in 5 years, particularly with data. We are in a place now better than where we were, thanks to the collective efforts of many of you in this room. Over the past 5 years, Minister Skinner has enabled the construction of an extraordinary foundation for medical research in New South Wales, and the building blocks for the future are obviously in place. And thanks to Gillian Skinner's leadership, the government has invested over $1 billion into health and medical research since 2011. We have increased investment in our respected medical research institutes. The Medical Devices Fund is bringing researchers and innovators together to solve complex health problems. And the Translational Research Grants Scheme is now supporting priority-driven population health and health services research. So these and other initiatives are adding capacity to our system and driving important changes. And I think we all agree that in this rapidly changing environment, and in light of the Commonwealth's very welcome investment in the new Medical Research Future Fund and its innovation agenda, now is the right time for us to check in, to review our achievements, to ask some questions, exchange ideas, to ensure that New South Wales can lead in the years ahead. We have extraordinary strengths in this state. We have some of the best and brightest researchers in the world. Many of you are here today. We have the strongest economy in Australia and one of the world's biggest infrastructure programs. We have a world-class health system. We have a supportive international pharmaceutical sector. We have mature biotechs and promising startups. And we have a strong and growing financial services sector. So now is the time to bring all those elements together. They are all elements to achieve great things for research and its applications in health in New South Wales. New South Wales can be a world-leading destination for health and medical research, but we need to leverage the great work that we have already done and to think big and to think globally. The world, as we all know, is changing fast, and it clearly will not wait for us. So this exchange today is an opportunity to consider how we can build on our strengths to make New South Wales that destination of choice for health and medical research, for researchers, for clinical trials, for biotechs, for pharmaceuticals, for investors. It's an opportunity to consider how together we can use research to deliver the world's best healthcare and improve patient outcomes. Our community deserves and demands nothing less. Today is an opportunity for you to tell me, to tell the government, what you feel needs to change, what we could do at a systems level to continue to drive medical research excellence in New South Wales. I've certainly met with many of you over the past 18 months. I've been moved by your determination to accelerate medical research and your vision for what is possible. My vision is for a New South Wales health and medical research system that builds on our strengths and plays to our advantages. A system that allows the translation of research from basic sciences all the way into clinical practice by embedding research into the health system. A research system focused on patients, which involves patients in their care to improve their lives. A system that utilises research to drive continuous improvement in all our health services. A system that is innovative, one that supports non-commercial research as well as enabling commercial research. A system that recognises private investment can be used effectively for the public good. And a system that makes New South Wales a world-leading destination for health and medical research. So today we'll focus on how that system can be brought to life. We'll discuss how we can embed a culture of research collaboration within the health system, across disciplines and with industry. We'll talk about how we create a high-quality, sustainable research workforce so that we can attract and retain the best and brightest researchers. We'll discuss how we can use research to deliver better value care and, of course, as part of that, better health outcomes within our health system, as well as how we make New South Wales a global leader in clinical trials. So I'm thrilled that to help lead these conversations today, we have four excellent facilitators. Nadia Levin from Research Australia, Professor Gemma Figtree of the University of Sydney, Teresa Anderson of the Sydney Local Health District, and Mitch Kirkham of Novartis. Good research changes lives. I don't have to tell you that. And with an ageing population and with more than 11 million Australians living with at least one chronic disease, we need great research that changes lives more than ever before. Good research means that we can all live better and for longer. We know that modern medicine is remarkable, sometimes even miraculous, but it all begins with great research. So I am thrilled that you are here. I think we know that good health is everything, and as I say, we know that it does begin with research. So I'm looking forward to hearing your insights today about how together we can make New South Wales that world-leading destination for health and medical research that we so strongly feel should and can be here. Thank you.